Okay, now we're going to talk about TENS, transcutaneous electrical nerve stimulation. So technically all electrical stimulation that we use is a type of TENS, but in our field of physical therapy we consider TENS, conventional TENS, as a sensory type of electrical stimulation. So that's how we'll use it here. It utilizes the gate control theory of pain because it stimulates those sensory nerves. It lasts only while the TENS is applied. Thus, you can use it continuously, as we talked about. You just have to worry about accommodation with it. It interrupts that pain, spasm, pain cycle that we've talked about. Modulated to decrease accommodation, so you have different settings that you can use within it, parameters, in order to help eliminate that possibility of accommodation. The pulse duration parameters is somewhere between 50 and 80 microseconds, which we realized it had to be less than 80. Remember, to get a sensory, if we go over that, then generally speaking we get a muscle contraction, which is not what we're looking for with a sensory response. The frequency is somewhere between 100 and 150 pulses per second. We want a sensory, submotor, comfortable tingle, so we do not want a muscle contraction with this one. We just want that comfortable tingle. We can treat up to 24 hours in a day, or we can do a 20 to 30 minute treatment in the clinic or at home. The low rate, or acupuncture-like TENS, or motor TENS we can call that. This is the one that uses the descending pathway and stimulates those endogenous opioids that we have, and they release. We call them endorphins and enkephalins. The pain reduction lasts 4 to 5 hours, so it's very effective. You need that longer pulse duration of 200 to 300 microseconds, so you realize with that you're probably getting a muscle contraction, correct, when you're going up to this length of a pulse duration. The frequency is going to be somewhere between 2 and 10 pulses per second because you're wanting to get that contraction. It's an amplitude is at a visible contraction. We're doing this on trigger points, muscle spasms. The treatment time is anywhere from 20 to 30 minutes. Burst mode TENS, we're not going to use this much in the lab, but just to know that this is another option for you. This sometimes helps with that accommodation factor. You get opioid production and release. You get these little bursts of pulses. Some people really like this setting better than others. It's a preset duration, somewhere between 100 and 300, and you'll be able to see that in the manual as to what each unit is a little bit unique. It's usually about 10 bursts each second, with pulses and bursts at 100 to 150 pulses per second. It's definitely, again, another visible contraction, and the treatment time is 20 to 30 minutes. So this is just giving you an example of that waveform and the rest in between that interburst interval. And you have this in your book as well. You can see this is a biphasic waveform, that it's got a neutral polarity that is equal positive and negative polarity on both sides, and that it's pulsed. Different indications. Again, we have osteoarthritis and rheumatoid arthritis, muscle inflammation, cervical myofascial pain and trigger points, acute and chronic pain. So this is the one that we can use this on day one with the patient because we're just getting a sensory response for this. Just like we would with a general effleurage with a patient, you're going to get that same response. You can also use it with a chronic low back pain, chronic or recurrent headaches. Oftentimes with these types of situations, you might do more of the motor TENS for them. We can also use it with that complex regional pain syndrome patient as another alternative to having to take pain medication. You see that you get 4 to 5 hours of relief with the motor TENS. So if we can get them to tolerate that, it's a good alternative for them. And neuropathic pains. Contraindications, again, we have the cardiac pacemakers or the defibrillators, pregnancy, overcarotid sinuses, laryngeal or pharyngeal muscles, sensitive eyes, areas of mucosal membranes, while operating hazardous machinery. And we say that because with the TENS unit, you'll see that you can wear that. If you're going to wear it up to 24 hours, somebody can have a little belt thing that it hooks onto, and then you have those wires. But you can see if you were operating hazardous material or machinery, and those wires got stuck somewhere, that could be a problem. You definitely don't want to use it for pain or condition where you're unsure where the etiology of that came from. And that's where we're thinking of certain cancers, that intractable night pain. You want to make sure you have a diagnosis before you, or pathology, before you apply that TENS unit on that patient. Precautions, it's for external use only. There are special types of biofeedback and electrical stim internally used, but the regular TENS unit is not for that. Somebody who's got a skin irritation, so if you've used this and they had a reaction to the pads, you're not going to put this back over those pads. Or if they had, say, some kind of skin rash, you're not going to put the pads over those areas. It's just going to irritate them. Not recommended in patients with myocardial disease or arrhythmias that are unstable. Definitely want to be cautious with those patients with impaired mentation. It may be that you're just going to use it while you're there present with them, not to let that be something that they take home with them or leave if they're in the skilled nursing facility and you put it on them and you leave their room. That's probably not a safe idea. Allodynia, I'm going to let you look that one up because that might be on your exam. You're going to let me know what that word means. With neuropathic pain, and we know the complex regional pain syndrome, sometimes with these patients you have to be cautious as to what you're using with them. So just a precaution. Treatment time for brief intense mode TENS must be limited to 15 minutes. Okay. So then we have interferential current, which is IFC. I'm going to do that as a separate video. So that's the N for TENS.